Okay, we've got Alyssa and Aaron here. They're going to talk to us about the Mizuho OSI Hana fracture table. Okay.
So first, you want your patient to go to sleep on the bed. Their cart, not the bed. And the disposable inserts for these come from materials. They're like a peach color. So the disposable is going to go on the foot first, and you want the heel to be at the very back of the disposable boot, and then you're going to secure it with Co-Band really good, and then after that you're going to put the foot and with the disposable on it in this boot here, and you want to make sure it's way down in here, and you can check to make sure the heel is back here at the very back, because if it's not, then during the case, it has happened before, when they pull traction, the foot can come out of this boot. Then you're going to tightly secure the boot like a ski boot. And then once all this is tight, then you're going to Co-Band this really well as well. So once you get the boots on the patient, you can move the patient over. You want to make sure your traction here is loose.
And you do that by...
And this is loose,
okay.
Tight. And so you'll move over and put the boot in here, and this locks it down so it doesn't come out. And if this moves this thing, so if this isn't in a good position, you can change that as well. So you get the patient over here. Next thing you're going to do is you're going to move down on the bed with the patient, and you want to have this post in here before you move down. So this post we wrap with cast padding, and then we put the softer web roll around the cast padding to help protect perineal nerve and stuff. On men, you want to make sure all their goods are out of the way. Foley catheter is out of the way. Then arm boards. This is the Hana Table arm board. We only have one at the moment, so for the second one we use the lateral multi-purpose positioner. It's a little longer here, but it still works. So this is usually tucked under here, and it just pulls out. Arm board goes in here. You can tighten it down. You can tighten this down and move it to wherever you want it. Another important feature to make sure before you come in the room with the patient, you want to make sure this femur lift works, because that's going to be the determining factor if they change to a different bed. Up here on the control panel, you can switch to either right femur lift or left femur lift. So depending on which side the surgery is on, say it's the left hip, you want the left side. These are specific to side, and they will say on it left femur lift. And it just slides in and out of there, and you can tighten it down here. This sometimes gets unattached. You just plug it in these two places. You also need the foot pedal. And it goes up and down. So you want to make sure this works. The rest of this comes from sterile processing. It's going to be sterile, goes on your back table, and it's the Hana Table parts. These legs here can unlock. You can manipulate them however you want them. A lot of times the surgeon will ask you to put the foot on the ground and then lock it where you want it. You want to lock this at 2 o'clock and don't go farther than 2 o'clock because it can break the bed. This is your gross traction here. You can lock it in place. And then you have fine traction here. Then you have internal and external rotation at 20 degrees, 40 degrees, whatever the surgeon requests.
Okay, thank you.